Okay, so a very relevant question is asked very frequently, and it is asked that suppose a patient develops pancreatitis. Obviously, we need know that the fluid resuscitation should be done in pancreatic patient because that's the only therapy which affects the mortality and severity of the pancreatitis. But what if the patient is having CKD? And many of you have asked that what if the patient is having low ejection fraction? So how do you manage fluid in that? So this is actually a complex scenario which is getting frequent nowadays because of the population, geriatric population like that. But the idea is you need to hydrate the patient in the capacity of the patient. You keep monitoring the chest whether the saturations are going up, down or not. You keep monitoring the chest by auscultating the chest. You look for signs of fluid overload. Uh, Diuretics are not recommended in pancreatitis in the first 24-48 hours. You need to hydrate. But if the CKD patient lands in fluid overload, then you may require that. So there is no single answer for this. It varies from case to case. But the idea is such patients should not be fluid resuscitated in a way that you give lot of amount of fluid in the initial phase, like 30 ml per kg or lots of 400 500 ml per hour you are giving initially. No, that's not the approach we follow. You start with fluid, like suppose it's a CKD patient but it looks dehydrated. You can start with 60 70 ml per hour, then increase to 100 ml per hour based on the hydration status or based on the chest status of the patient, whether the patient is developing pulmonary edema or not, or fluid overload or not. Same with the what you call low ejection fraction patients. You start with 40 ml per hour, 50 ml per hour, see how the patient responds to that. So that's the way it should be done. The idea is to keep the patient adequately hydrated with close monitoring of the uh, fluid status, specifically the pulmonary edema part or chest congestion. This is something which no straight answer can be given, but yes, you need to keep monitor the hemodynamics and then try to give whatever fluid to this patient in such scenarios. I hope this clarifies, and please do read more about it. Thank you.